Alabama Republican Congressman Spencer Bachus. And Congressman, you were telling me you were opposed to this on the very big grounds that it's government going too far. Explain.
Oh, absolutely. Medicare has been funded with a payroll tax, but now they move into taxing dividends, annuities, pensions, any unearned income. So if you have rental income, if you rent out a room, that will go into Medicare now. So there's a tremendous increase in taxes and in health care premiums. They admit that health care premiums will go up.
All right, so they also say that right away the goodies kick in. That is, if you will, pre-existing coverage kicks in. Coverage for children as old as 26 kicks in. So people at home might immediately see the good stuff before the bad stuff, right?
Yeah, well, the Class Act, which is really a new government program to cover federal insurance for long-term care, they're going to start collecting premiums long before they start giving out benefits and that program kicks in. That alone moves the numbers several $100 billion. So no, all the payments, you pay into it, and then the benefits are both illusory and they're long-term.
All right, so Congress, maybe you could educate me on what the CBO is saying. Because the first cover sheet read from the CBO was that this did indeed get to be deficit neutral, $118 billion saved over 10 years. But now there's a potential follow-up CBO report, which I guess has to account for exemptions and allowances made for doctors who were ticked that their Medicare cuts were extreme. Do you know if that's going to be in the second CBO read, and if so, how that could affect it?
Yeah, there is a Medicare fix, and they're not counting that. So
in other words, when the CBO comes out with a score, something very big like that won't even be in the score.
No, and there's another thing that's not in the score. You've heard about these Cadillac plans taxing the unions. Well, they cut a deal with the unions not to tax those benefits the first 10 years. But the second 10 years, all that savings is because they're going to tax all your better health care.
That I understand, but bottom line, you're telling me that when the CBO comes up with this follow-up score, whenever, if ever, it won't have this Medicare thing, so it's probably going to echo what the original score was.
Oh, absolutely. It's illusory. That's probably the best word I could say. And, the other thing that's a tremendous mistake is that he's targeted the insurance companies and told the American people that's where the money's going. Well, their total profits amount to just a little over a day of health care spending. So if you wiped out every bit of their profits, if you put them out of business, you'd save 1 day.
Wow. That's how big the numbers are.
Oh,
okay, Congressman, thank you very, very much.
Thank you.
Very good seeing you.
Thank you
for taking the time.